Welcome to Module 2. Now that we've discussed some of the emotional challenges of breast cancer, let's begin exploring tools that can help. It is important to remember that each person is unique. Therefore, it is essential to experiment with these various tools and methods to discover what works for you. Throughout this module, we'll talk about a bunch of different strategies and tips. Be sure to take notes on what you find enjoyable and what makes you feel good. As a reminder, you do not have to manage every emotion perfectly. Consistently practicing small coping strategies can support emotional wellness over time. Everyone copes differently. One strategy may work well for one person and not for another. The goal of this workbook is to build a toolbox of strategies that you can use depending on what you need that day. Some examples of healthy coping mechanisms include relaxation and breathing techniques, mindfulness and grounding, physical activity and movement, journaling and emotional expression, engagement in meaningful occupations, social support and communication, as well as self-care and healthy routines. The first technique that we will be exploring is relaxation and mindfulness. Mindfulness has an extremely positive impact on mental and physical symptoms of breast cancer, as seen throughout the research. So, what exactly is mindfulness? Mindfulness can be defined as an intentional and non judgmental awareness of your current thoughts, feelings, and body sensations. It involves three core principles. This includes paying attention on purpose and without judgment. Benefits of practicing mindfulness based techniques include reducing feelings of anxiety, depression, and stress, increasing positive feelings such as positive self view, feelings of peace, and meaning in life, improving overall quality of life, and enhancing emotional regulation. Mindfulness works by bringing attention back to the present moment rather than feeling the anxiety of worrying about the future. Here are a few different techniques that you can use. The first relaxation and mindfulness technique that we will discuss is deep breathing. There are two simple deep breathing practices that I will show you today. The first is belly breathing. First, you want to start by lying down or sitting in a chair. You want to place one hand on your chest and the other on your stomach. As you slowly inhale through your nose, you want to make sure that the hand on your chest stays still while this hand on your stomach rises. This will ensure that you're breathing through your diaphragm and not through your chest. So it'll look like this. And if you see, you're exhaling through pursed lips while you're feeling your hand on your stomach sink back inward. You want to continue this practice for 5 to 10 minutes until you feel more grounded again. Let's quickly discuss why this deep breathing technique is something that can work to help reduce feelings of anxiety, stress, and depression directly in the moment. So, as infants, we primarily practice this diaphragmatic breathing as this directly stimulates the vagus nerve. This is going to activate your parasympathetic nervous system. This takes your state of mind from a fight or flight mode directly to a rest and digest. This is going to lower your heart rate, decrease stress hormones such as cortisol, and immediately give your body a sense of safety. It also can lower your blood pressure. So, as I was saying, as infants, we primarily do this form of breathing, but as we grow older, typically around age 1 to 2, we transition to more of a chest breathing. So, taking a moment to really breathe through your diaphragm and activate that calm sense can be extremely beneficial in times of stress. If you're just having an extremely busy day and you need to take a rest break, this is a great technique to use. The next technique is called box breathing. You can use, if you printed out the workbook, you can use this guide here for box breathing, or you can draw one out yourself and carry it around with you. Again, you want to start by sitting upright in a comfortable chair with your feet flat on the floor. You want to inhale for 4 seconds by breathing through your nose slowly. You're going to hold that breath for another 4 seconds. Slowly exhale through pursed lips for 4 seconds. And then you're going to hold your breath again. You're going to repeat that process again for 3 to 5 minutes until you feel recentered or better regulated. So, similarly to belly breathing, box breathing acts in a similar way to control the heightened emotional state. It is going to also stimulate the vagus nerve to activate that parasympathetic nervous system. Also, by holding your breath, this practice allows for a temporary accumulation of carbon dioxide, and this elevation is going to signal your blood to release more oxygen efficiently into your muscles and tissues. This overall, if you continue this practice, it is going to improve how your body utilizes that oxygen within your bloodstream. Additionally, both techniques are great to improve lung efficiency overall. So now that you've had a moment to practice both belly breathing and box breathing, I'd like you to pause this video and take a moment to take some notes on how both of these techniques felt. Even if either one of these techniques didn't work for you, even just taking a moment of calm and just having a second to focus on just your breath overall can be amazing to just bring yourself back into a grounding state and not in such a heightened emotional state. Mindfulness-based art therapy is a practice that combines these mindfulness-based strategies such as meditation, deep breathing, and body scans with art. This practice provides a judgment-free space to explore and understand complex emotions. Here are 2 examples of some self-guided mindfulness-based art therapy practices. Here are 2 simple mindfulness-based art therapy self-guided practices. The first is called guided imagery meditation. To do this, you'll dedicate 10 to 15 minutes of listening to a guided meditation. You can find these videos on YouTube or other platforms. Afterward, you will take some time to express yourself creatively by using watercolors, crayons, markers, any medium that you prefer to visually represent the colors, shapes, or emotions that emerge during that meditation. Next, you have mindful coloring. Studies have shown that engaging in structured, intricate pattern coloring pages can reduce feelings of anxiety and stress and decrease acute and chronic pain. You can find plenty of examples online that are free and available to print, or they also, if you go to Barnes& and Noble, Target, anything like that, you'll be able to find adult coloring books that follow this intricate patterned system. It's important that you are able to fully dive yourself into this practice because that is what is going to take away that pain by guiding your brain towards focusing on that coloring page rather than what the pain you might be experiencing. The 5 senses exercise is a mindfulness-based exercise that can be done almost anywhere. It is a great way to bring awareness back to your senses and where you are if you begin to feel overwhelmed. You first start this practice by naming 5 things that you can see. Take a moment to observe your surroundings and identify different items or objects nearby. Try to select things that you might normally not pay attention to. Next, you're going to name 4 things that you can feel. You'll take a moment to recognize 4 sensations that you currently feel. This might be the texture of your clothing, the gentle breeze if you're outdoors, or the fabric of the chair that you're sitting on. Next, you'll name 3 things that you can hear. Take a moment to listen and recognize different things you may hear in the background. It may be a fan, a car driving by, a siren, anything like that. Next, take a moment to filter through what is around you and recognize 2 things that you can smell. Lastly, to finish the exercise, you name 1 thing that you can taste. You can take a sip of a drink, chew some gum, or simply notice the taste that's in your mouth. This exercise can be useful in times where you're feeling an intense sense of panic or you feel extremely overwhelmed. This practice can just help you feel grounded within yourself again. So similarly to how the belly breathing and box breathing that we spoke about earlier can help interrupt that fight or flight emotion, the 5 senses exercise works very similarly. The 5 senses exercise can actively interrupt that brain's fight or flight feeling and redirects towards the present moment. This exercise works by forcing your brain to use its executive functioning complex, which is located in the prefrontal cortex. It requires you to categorize and name what you sense, and by doing that, you can interrupt racing thoughts, giving your brain a non-threatening task to focus on. Next, we're going to talk about physical activity. Exercise isn't only good for just your body, it can also positively impact your mental health as well. Regularly engaging in physical activity can reduce feelings of anxiety, stress, and depression, combat fatigue, improve cognitive function, and regulate stress hormones. Experts recommend aiming for 30 minutes of moderate aerobic exercise 3 to 5 days a week. These can include things such as brisk walking, light cycling, or swimming. You also want to incorporate light resistance or muscle strengthening exercises 2 days a week. On top of the aerobic exercises, it is also extremely important to prioritize weight-bearing exercises and resistance exercises as well. This is important as treatments such as chemotherapy and aromatase inhibitors can accelerate bone loss. So participating in these exercises, you can help to reduce the amount of bone loss that you may experience. To go along with that point, it is also extremely important to talk to your doctor to talk about different methods that they can use if you're experiencing something like that. As an important tip, it does not have to be done all at once. Breaking it down into sessions throughout the day can be equally as beneficial and less overwhelming when you first begin an exercise routine. Always consult with your oncologist or healthcare team before starting a new exercise routine. There are also additional strategies where you can improve your overall mental wellness while incorporating exercise. This can include group activities such as group yoga, walking clubs, or water aerobics, as well as mind-body exercises, including yoga, meditation, and guided deep breathing. So overall, exercise is highly regarded by physicians and researchers alike. Women diagnosed with breast cancer can significantly improve their overall quality of life and participation in daily activities through gentle exercise each day. As always, it is important to listen to your body and take rest breaks and days as needed. Next, we're going to talk about journaling. Journaling is another mindfulness-based technique that can help bring attention to the present moment, enhance self-awareness, and improve overall emotional regulation. The first, gratitude journaling. Gratitude journaling is a practice of regularly writing down things that you are thankful for. This is a simple and yet effective practice that has been shown to improve overall emotional well-being. For example, in a study conducted in South Korea, including women with breast cancer, the women who engaged in gratitude journaling reported improved quality of life, greater gratitude, and stronger resilience than those who did not. It is important to note for this practice that it can simply be 1 to 2 things that you are grateful for each day. Even if you're having a difficult day, even just being grateful that you were able to get out of bed or that you had somebody come over and cook you a meal, things like that. You can also take a moment to pause here and practice some of these journaling prompts from the National Breast Cancer Foundation for self-reflection and self-discovery. Some of these journaling prompts include: how would you describe yourself in 3 words? How would others describe you in 3 words? What are your best qualities? What are the 5 most meaningful lessons you have learned this year? What are some of your favorite memories with friends and family? And what are 10 things that make you smile the most? One of the healthiest coping strategies is engaging in activities that bring meaning and purpose. Like I stated in our introduction video, occupations refer to the daily life activities that fill your time and give your life meaning. They also give you a sense of purpose and identity. It is important to recognize the distinction between occupational participation and occupational engagement. Occupational participation is simply the act of doing daily activities, such as brushing your teeth, taking a shower, washing your hair, things like that. While occupational engagement refers to being fully immersed in appreciating the personal meaning that you find behind that activity. For example, cooking a meal. For some people, it might just be something that they have to do each day and they don't personally find too much meaning within that. But for others, if you're cooking a meal for your family, you may find that deeper meaning behind it. And when you're going throughout that activity, just take a moment to reflect and personally Identify with what makes that activity meaningful for you. You're caring for your family, you're cooking a meal, you're fueling your and their bodies. By engaging in activities where you can find that purpose and meaning, you can significantly improve your overall mental health and well-being throughout the breast cancer journey. We will dive into strategies that you can use to improve and increase occupational engagement in our next module. Now we're going to talk about SMART goals. Research suggests that writing down goals can increase commitment and follow through. An effective framework for writing down goals is called SMART goals. S stands for specific. What do you want to achieve? The clearer you are within your goal, the easier it is to follow through. M stands for measurable. You're going to choose a strategy to track your progress and monitor it over time. A stands for achievable. You want to make sure that it is realistic. It should push you a little bit, but you know that it's something you can get done. For example, I won't be setting a goal to run a marathon. I'm going to start with something smaller, maybe a mile. Next, you want to make it relevant. Is it relevant to your life right now? Choose a goal that matters to you and connects to your personal priorities. Last, timely. When do you want to do it? Make sure you set a deadline. Knowing when you want to finish each goal helps you stay on track. Benefits of SMART goals include enhanced focus, structured progress tracking, reduced procrastination, and significantly higher chances of success. An example of a SMART goal includes, by the end of this month, I will take a 15-minute walk outside 4 out of the 7 days of the week. So it's specific because it's a 15-minute walk. It's measurable. You want to hit that 4 out of 7 days a week. It's achievable because it's not 30 minutes. It's not an hour of walking. I'm not running. It's just a short 15-minute walk. It's relevant to my life right now because I want to increase my physical health and emotional well-being through walking outside. And it's timely because I'm going to start doing this goal by the end of the month. I don't like how I said that. And lastly, it's timely because I've given myself by the end of the month to start participating in this activity. For this module's reflection, I want you to take a moment to reflect on what you've learned in this module, as well as what you've learned in past experiences with coping strategies. Identify at least one beneficial practice that you can add into your daily routine and consistently commit to maintaining it. And now we'll go on to our next video for Module 3.